Good afternoon. New Mexico is in its second phase of distribution of the COVID-19 vaccine. And as the state's top doctor explained today, if supply can keep up, health officials are hoping to vaccinate up to 8,000 people a day. Here's News 13's Gabrielle Burkhart.
Human Services Secretary Dr. David Scrase says he's excited to get his second shot today and hopes to have most of the state's population protected against the virus in the coming months.
I'd like to see 70% of our population immune.
According to the Department of Health's running total, so far nearly 7% of New Mexico's population has been infected with COVID-19. Just over 3% of the state's population have taken a COVID-19 vaccine, and thousands more are lined up to get vaccinated.
We think that group of Loveless University, Presbyterian, Christus St. Vincent could potentially be delivering 8,000 vaccines a day in another month as we get ramped up. And now that depends on having enough supply to do that.
If supply can keep up, Dr. Scrase is hopeful to distribute more than 1 million vaccines statewide in the next 6 months and get most of New Mexico's population protected against COVID-19, a virus that's killed hundreds of thousands across the country and upended lives across the globe.
Morale was really low, 9 months of caring for coronavirus patients, having 20% of them who are hospitalized die has been very, very difficult.
The current vaccine phase includes people 75 and older, those at risk of COVID complications, teachers, public safety staff, and frontline essential workers. A practicing physician, Dr. Scrase, will receive his second dose of the COVID-19 vaccine today and says he's feeling hopeful for 2021.
People have a new energy, a new esprit de corps, a new commitment to getting us through this whole pandemic.
Since the vaccine trials only had 2 months worth of data before the FDA granted emergency use authorization, health officials are still studying how long protection against the virus lasts. Dr. Scrase says the vaccine could become a seasonal necessity, much like the flu shot. Back to you.
Okay, thanks, Gabby. Now, coming up at 5:30, we'll have more on what we're learning about reinfections and why the state doctor says the data is encouraging.